So we know it's Cancer Awareness Month,
Yes.
but we know who the players are here, but what exactly is a hospice?
A hospice is a place of rest. In the old days, you know, the people traveling through the country, when they came to the end of the day, they had nowhere to rest. There was a nurse, Cicely, who opened this place for resting for the travelers, and eventually it has evolved into a health care facility for terminally ill patients. Here in Trinidad, the only hospice for terminally ill cancer patients is the Vitas House Hospice, a service of the Trinidad and Tobago Cancer Society.
And where's Vitas House located?
We are located in the compound of the St. James Medical Complex. Yeah, we have a building there.
Now, I want to ask about how it is people can actually avail themselves of the services.
Okay. Vitas House has a referral system which would come through the doctors, the institutions that are treating patients who would have gone through the realm of whatever was available and helpful to them in terms of chemo, radiation, surgery, medication. And when it gets to the point where the disease has advanced to the stage where medically their doctors determine there isn't much more that can be done for them, and the relatives or the patient may not have the facilities for ongoing care at home, they can be referred to us for hospice care, which is end-of-life treatment. So with a prognosis of 3 to 6 months and the conditions that we can easily manage and take care of you, what we do is provide pain and symptom control to our patients. We have a 12-room facility, fully air-conditioned, best nurses and doctors you could find anywhere, I could guarantee you that. And you know, they come to us, go through the process with the next of kin, ensure that everybody understands why the patient is coming to us, and then they leave them in our good hands.
Nikita, why has Oasis partnered with Vitas House in this sort of way?
Okay, well, every year globally we recognize Cancer Month in October. So the brand wanted to basically launch a national campaign where we give everybody the opportunity to do their part to support and give back to a cause that I think has affected every one of us in some way or the other, whether it's ourselves, our mothers, our fathers, somebody that we know personally. So we wanted to design a campaign, so we have done so in the form of 2 ways. We have done these special pink labels that when you purchase any 330 ml Oasis premium purified water or any 1.5 liter water with this special pink label, part proceeds of that go to Vitas House. And we also designed an online platform where people can go online and pledge their donations, and 100% of those donations go directly to Vitas House.
In terms of going online, what is the URL? What is the page?
It is oasiscancerfund.com. So you can log on oasiscancerfund.com and go on there and pledge your own donations as well.
Sometimes people see about things after the fact. If people wanted to actually continue past the month of October, because like you said, they realize that this is a cause that needs to happen, and we have 12 months in the year as opposed to just October. Is Oasis open to that?
Yes, we are. The URL will be still available past October. This is the first time we're doing an initiative as big as this one, and with speaking to Mrs. Mutu, they operate basically on the sponsorships and donations of persons and corporations. So yes, this is the initial stage of the campaign, but for sure after October we will be continuing our support with Vitas House and other cancer entities.
Ms. Mutu, you talk about having the best service providers, and what kind of relationship do the people at Vitas House have with the clients that they take care of?
Well, it usually becomes a one-on-one, uncle and auntie. You know, with time, the PCAs get very familiar and comfortable, and likewise, the patients get very comfortable with our staff. So you find it develops a camaraderie and love that is there, you know, and that is what happens every day. Because, you know, patients coming to us, you know, would have gone through the realm of going through treatment through the institutions, the government institutions, and it's, sorry to say, it's like chalk and cheese. So when they come to our facility, you know, they're in heaven. And you know, the surprising thing is Vitas House has been there 9 years now, and very many people say they never heard of us. They don't know we have this facility in Trinidad. You know, they can't believe that Trinidad has such a facility because, you know, we are a free service.
But Ms.
Totally.
Romain actually started to
Yes.
speak about the way that
We operate.
Vitas House is sustained.
Yep.
Give us a little more info about that.
Well, as I said initially, we are a service of the Trinidad and Tobago Cancer Society. It was initially established as a pain facility, but it never materialized that way. So it was always a free hospice Patients come to us, medical care, board and lodge, food. Medication, which we don't have, that's what we ask the relatives to supply by prescription and their toiletries. But other than that, we exist by way of our fundraising efforts, which we have a major tea party in the first Sunday in May, which is our, big event to raise our funds. And then with that, we have donations and contributions and the support of the corporate like SM Jaleel and Oasis brand that do, fundraising initiatives to assist us through the way.
And if people wanted to reach out to Vitas House directly, how do they do that?
Well, as I said, we are located in the compound of the St. James Medical Complex. We are on Facebook. We have a web page. Our numbers are 628-4673 and 628-9824. Our staff, our nursing staff, operate round the clock, so they're there 24 hours, so calls are always received. And, visits are always welcomed.
How do visitors interact with the folks at the hospice?
Well, basically, some patients have their relatives who would come and visit them as best as they can, because some people live far, they don't have the means by which to get daily and stuff like that, but we have volunteers. Volunteers come to the hospice, they interact with the patients, they pray with them, some of them sing to them, just read to them, just interact with them and, break the monotony of their day.
In terms of that volunteerism, Ms. Romania spoke about saying you recognize the month every year. Why Vitas House this year?
For us, Vitas House, as Lilia is mentioning, they perform a labor of love. They operate basically on sponsorships and donations. There are so many other entities that you can donate to, but Vitas House kind of stood out to us because we try to provide the best quality water for the people of Trinidad and Tobago. We have international standards, we're certified, and it's basically the same thing that Vitas House does. They try to provide the best quality service that they can for people at the end of their term.
You said this is the biggest such initiative that
Yes.
that you've attempted, but at the same time we have it in the face of this economic situation. I'm wondering, what are some of the challenges, or is it a matter of being ambitious, or you're just saying, okay, well, this is something that needs to be done?
It is something that needs to be done. The brand is always attached to anything health, wellness, and fitness associated. So this is just an extension of that. I understand the times are hard at this point in time, but it does not negate the fact that we still need to do our part for a cause such as this one.
And I want to say that, yes, the times are hard, and you would expect, people are looking at the bottom line. But I must say, when it comes to the Vitas House Hospice, people's hearts are very soft. We try our best in going out there, bringing awareness to the facility to raise funds, because that's how we exist. But sometimes people we don't know come to us, and they bring sizable, donations. So it is something that people feel close to, and there are good people in Trinidad and Tobago.
What is the thing that you find the common thread for people who are actually passing through the hospice?
As sad as it is, I live my life. People live their lives without a care of tomorrow. They may have had symptoms, they might have been doing things that were not right, and it didn't matter to them. Sometimes even though the patient themselves know that they have been diagnosed, they don't tell their families. It's sometimes very to the end that the families become aware, and there's such a breakdown in family life that you have a father and a mother who is suffering and sick, and the children are going about their lives, and they don't even know that mommy is sick until it comes to the very end. And then they jump into the fray to realize, well, we didn't know, she didn't tell us, but you've seen a very sick person.
And I see the passion and the emotion that you're bringing to the table. And like you said, Ms. Romaine, so many of us have been touched by cancer. People we know, people we're very friendly with, and then sometimes you wonder whether or not it's the choices, whether or not it's luck, whether or not it's out of the blue, why me? I wanted to win the lotto instead of winning this.
Yeah.
But in terms of saying that connection and how it is we come together as a people, I'm very glad to hear that people, in terms of Vitas House, people are recognizing that Vitas House exists, one, and there are ways that we can contribute in terms of moving forward.
Yes.
But this is what is happening. This is the start of it. I want you to project into the future a little bit. What are some of the other things? Because I want to put it out there because Ms. Mutu was talking about the first Sunday in May as a tea party, and we want to see Oasis there as well.
The brand would love to be part of it. We would love to continue being part of the uprunning and the upkeeping of Vitas House. As I mentioned, this is not now alone. This is the pilot. This is the first stage of it. And we will be able to look at this program and see how it went and come up with other strategies and other ways that we can help this cause going forward.
Some people may not say, okay, well, Vitas House is not necessarily the one that they're attached to because their relative doesn't necessarily need palliative care as well. The hospice. But are there other arms, because you said you're coming out of the Cancer Society, if somebody wanted to actually say, okay, I think I want to be more generalistic and deal with Cancer Society, where would you direct them to, Ms. Mutu?
I don't understand.
In terms of like reaching to the Cancer Society to find out, okay, this is what Vitas House does.
Yeah.
There are other people who are kind of specialized. How do people contact the Cancer Society?
For the Cancer Society, they're at 62 Rosalino Street in Woodbrook. Their numbers are 622-6827 and 800-8827. And they have a great awareness program. You know, they have the caravans. They go out with their buses. They do mobile tests throughout Trinidad and Tobago. Actually, they just spent a week in Tobago doing the mobiles and doing the EduFest, this being October month. And in Trinidad, they are having their Great Walk. They had EduFest this week, and the Great Walk is on the 22nd in conjunction with Republic Bank, the main sponsor.